Hi, Miss Jones. I'm Jenny, and I'm your student nurse today. I hear you're going home here shortly. That is so exciting. You've had quite the past few days dealing with your blood pressure. That was quite the emergency. Yes, crazy, I know. I'm so glad that we could begin to get that under control for you. I wanted to take a few moments to go over a new medication that the doctor's sending you home with today and answer any questions you might have, okay? I've seen a trend in your blood pressure, and I see that it's been quite wonky lately, hasn't it? It looks like the trend is that it keeps getting higher and higher, and after this last hospital stay from the emergent situation with your blood pressure, it looks like you're probably getting in danger of preeclampsia. Preeclampsia is a potential complication you could experience during pregnancy with telltale signs of having high blood pressure and maybe some damage to another organ. Most of the time that happens in either your liver or your kidneys. This complication can be very scary as an expectant mother, so we want to try to catch it early. I understand that you have had high blood pressure, that you've never had high blood pressure in your entire life. And this is one of those things that we medically cannot understand on why you have this developing onset. But some specialists believe that in your situation, in an emergent situation like you had, situations like preeclampsia begin in the placenta, which feed and nourish your baby throughout pregnancy. Early in pregnancy, new blood vessels develop and evolve to efficiently send blood to the placenta to feed and nurture your baby. Preeclamptic women, their new blood vessels are very narrow. So normal blood vessels are like this, and the new blood vessels in pregnant women like yourself are very narrow, and they don't send enough blood to the placenta, causing the blood pressure to rise. Your high blood pressure usually goes back to normal after the birth of your little one, it just happens during your pregnancy. But let me ask you, you don't smoke, right? I know it's very frowned upon in pregnancy, but I just wanted to make sure that you did not do that and confirm, right? Okay, great. There are a few things that prevent high blood pressure, and you can for sure try to stay active. I know that that's getting hard at this phase of your pregnancy, but try to avoid really salty foods, keep coming to all of these prenatal appointments, and avoid any alcohol if you've been trying to attempt any of that. And it looks like to keep both of you and baby safe, you are given an IV med of the same thing, hydralazine, or more commonly known as Apresoline. That was the fluid that was going in your IV while you were here with us, but the doctor is also sending you home with an oral medication of the same thing to try to keep that under control. The medication is an antihypertensive, which is a really big word, saying that it was going to try to lower your blood pressure. It also has an unlabeled use of treating preeclampsia, so we're going to try to take care of both things at the same time. It works directly on your muscles, blood vessels, to help relax them. It's a vasodilator, so that means that you're narrowing blood vessels that are feeding your placenta. Like I told you earlier, we're going to relax them, which causes them to open up a little bit more, which then lowers your blood pressure when blood can flow through those. Think of like a water hose, and if you start kinking it and making it get smaller and smaller, we're going to relax it and open that hose back up so that blood flows through there a whole lot easier, bringing your blood pressure back down. On this medication, you do need to make sure that you are taking it with foods, or it can cause you to have some GI issues. This helps the medicine be distributed a whole lot easier in your body, making it more bioavailable. All right, and so that's just making it easier for your body to absorb. You may also want to pay close attention to the swelling in your feet. And call us if you notice them getting any significantly big, any larger. I know that edema, or the swelling in your feet, is quite common, especially at this phase in pregnancy, but we just want to keep a close eye on it, because that can be an adverse effect of the medication that we're starting you on. But again, this medication should really be able to help with that. You'll start using the restroom a whole lot more to get rid of that water, to get rid of that salt, and lower your blood pressure. Now, there's some other small side effects that I want you to know about and to watch out for. You could get headaches, and with this medication, your blood pressure could get too low, making you hypotensive. And then there was that abnormal swelling that I talked to you about. There's some more major ones like difficulty breathing, and like I was telling you, just make sure you eat this, take this medication with food, because there could be some GI or some tummy issues. Those are just some of the side effects that I want you to be aware of while taking Apresoline, so don't forget, it's called Apresoline, and let us know if you have any of those issues, all right? Hopefully I've covered everything for you. Do you have any questions for me? Okay. You and baby will continue to grow and be healthy. You've just got a few more weeks, and I'll see you back here shortly, and we will follow up with you and see how your blood pressure and the swelling in your feet and things have been. Okay? All right, Miss Jones, you have a wonderful day, and good luck with the rest of your pregnancy.